If you want to find out an easy way to help prevent UTIs, then make sure you keep watching. Today, I'm very excited to talk about a health hack preventing UTIs. It's something that is cost effective, it has very little side effects, and it's something that you don't need a prescription for. There was a study that was conducted in Rome, in Italy, by the Department of Gynecological Obstetrics and Urologic Sciences, so basically gynecologists and urologists. And they found that D-mannose, which is a supplement, shows promising support in helping prevent urinary tract infections in women. Several studies have shown that D-mannose is effective in inhibiting the bacteria from sticking, right? Sticking or adhering to that bladder wall. So it inhibits bacterial adhesion responsible for UTIs, and usually the bacteria responsible for UTIs is E. coli, and thereby reducing the risk of infection. Authors show an excellent tolerability and safety, so it's very well tolerated and it's very safe, unlike having to take antibiotics, a course of antibiotics for long term. And this study was conducted to show the efficacy. How effective is D-mannose alone in treating and solving acute urinary tract infections? The study found that D-mannose was in fact very effective in treating UTIs and as a prevention method in selected patients with uncomplicated cystitis. The key word is uncomplicated. If you have a complicated urinary tract infection, that means that it's gone from the bladder and it's spread to your kidneys, right? You have two kidneys and goes up the ureter to the little kidneys. So if it's complicated, if someone is having flank pain, which is lower back pain, chills, fever, nausea, all that stuff, you need to be going to the doctor and getting some antibiotics. But for a simple infection that's located only in the bladder, D-mannose is very effective. What is exciting for me is that it helps prevent UTIs. I have interstitial cystitis, so my bladder, anything I drink that is acidic or citrusy will inflame my bladder. Therefore, I am predisposed to getting UTIs, or if I get a UTI, then it will be very painful and it will further damage my bladder. So I don't want that to happen. So this is an effective way to help prevent UTIs, and also with very little side effects, because people that have to take antibiotics for the rest of their life, sometimes they don't tolerate it well. It can mess up their stomach, it can make them nauseous, and it can decrease the good bacteria in their gut. Sometimes women will take an antibiotic and they end up with a yeast infection. Why? Because we do need bacteria in our system. We have a delicate balance of good bacteria versus bad bacteria. And when we kill all the bacteria, that's not necessarily good either. That's why this whole movement with probiotics is going on, because people are finally finding out that it's good to have bacteria in your gut, and we do need it. So the results of this study showed that there was a significant improvement in the majority of symptoms. So it helped symptoms of a UTI, and it helped resolve UTIs, as we see here. So it helped with symptoms, it helped with resolution, and it also helps prevent them, right, as a prophylactic agent. And once again, that's where for me, I don't think I would necessarily feel comfortable treating UTI solely with D-mannose, but as a prevention method, I'm all for it. And it was a prophylactic agent, was studied for 6 months, and it showed promising results. So when something says that there was significant improvement in this p-value, what this means, it means that results are statistically significant. In the world of statistics, a p-value of less than 0.05 means that there is nothing else that could be responsible for the improvement in symptoms. And even here in the resolution, look at this p-value, 0.00001. That means that there are no other correlated factors other than D-mannose that are responsible for this. Sometimes we do studies and it shows if the p-value is greater than 0.05, it means that maybe something else is responsible for these effects. So all of these results were statistically significant, which means that scientifically, right, when we talk about how do we know what works and what doesn't, if we can quantify it, if we can put it in a numerical statistic, then we know like, yes, it works or no, it doesn't. We are very, we like things we can measure. So this was measured and yes, it was effective. So once again, the conclusion of the study is that D-mannose is an effective aid in acute cystitis management, and also it's a successful prophylactic agent in selected populations, and they do say that they would like to have more studies to confirm the results of this pilot study. This was just a quick Amazon search of what D-mannose looks like. I looked up D-mannose and non-GMO. That's why they're a little bit more pricey. But again, you pay for quality. I would recommend that if you're going to get a supplement, you want it to be organic and you want it to be as clean as possible. Because if you're going to get a supplement that is not pure and just has maybe a little bit of D-mannose, it's not going to be effective. So essentially you're throwing your money away. So this is one D-mannose with cranberry. This is a powder form. This is a capsule form, and see, this is non-GMO, this is vegan. So they have lots of options in regards to what you can purchase. The one that I have bought is this one, and again, I'm not getting any type of compensation for it, but this one is also, it's gluten-free, it's vegan, it's non-GMO, and it says it's made by Nested Naturals. If you suffer from UTIs, I really hope that if you take this supplement after it's been approved by your physician, that this is a life changer for you and that it helps you get these hurtful, annoying infections, and it will save you a doctor's visit. It will save you a visit to the pharmacy. It will save you the pain, the grief, and all that. And as always with my memes, it says, when you're giving a report on a patient who's been on the unit forever to a nurse that's never had them. And this is essentially what it feels like. A patient's been there for 30 days and there's so much to tell that nurse that's coming onto the shift that you feel like you're going a little bit insane trying to just condense everything into like a 3-minute report. Thank you for watching. Thank you so much for watching. I really hope that what you learned here today will help you in your future and will help prevent UTIs. And the goal is, of course, to keep you all happy, healthy. Thank you for watching. Make sure you hit the like and subscribe button.